Oregon prisons are working to reform operations for its approximately 12,000 inmates after a consulting firm reviewed complaints against the state. Falcon Correctional and Community Services suggested changes after visiting state prisons between March and July of this year. They were looking at the health of adults in custody. It's an issue we've investigated since the summer of 2024 when we were alerted to allegations of poor health and sexual abuse claims within the Department of Corrections.
The complaints had been happening for a long time within our Health Services Division, both from adults in custody and from staff. They were raising concerns up, and those concerns, frankly, weren't getting heard. It took a comprehensive investigation for us to get to the bottom of what needed to happen and for us to have the assessment from Falcon to point us in the right direction.
Since the review, the Department of Corrections says it has changed leadership within its health services and has implemented other changes to address the lack of regular health assessments for inmates and the accurate handling of records.
Mistakes can happen and probably do happen. In prior systems I've been in, I can honestly say people do get transferred, and sometimes the medication or all the records don't make it with them on that transport. The continuous quality improvement program in itself is one of those areas that's going to be intended to help capture these things. So if we find we're not completing all our work before a patient moves to the next facility, that's something that should be detected.
The state is working to determine the full cost of the changes, which is expected to be a topic in the upcoming legislative session.